The second one is risk versus benefit and beneficence. So the trials must justify the risks. That seems apparent when you're in the developed world, but it wasn't that long ago, regardless of how much the industry wants to hide it or sweep it under the rug. They were trying to do studies, they being Big Pharma, in third world countries using placebo on life-threatening conditions. Even though in the developed world you're not allowed to do that because the IRBs say if it's a life-threatening condition, you can't have placebo, you have to have a standard of care. And that's because of this principle. Number 2, risk versus benefit, beneficence. And just because in the developed world we have a standard of care because we are richer countries, does not mean that you can go overseas to Africa or India, which is what was happening in the 90s. And I'm not trying to get canceled here, but the truth is the truth. And they were trying to do HIV trials and cancer studies using placebo arms. So thank God we're over that. Thank God we have a decentralized form of communication now where we hold each other accountable in this industry and keeping these 13 core principles in mind of GCP. So risk versus benefit. The trials must justify the risk. Obviously, the more dire the medical condition and the more rare the medical condition, the less treatment alternatives exist for patients outside of research, right? The less burden of proof you actually need, because risk and benefit needs to be weighed. But if you have healthy volunteers, or if you have relatively healthy people, let's say they don't have any issues, but they're in a depression study, you can't just throw toxic IP at them and study it.